Okay, in this case we're going to be doing case number 4, so go to New Project, start from Patient CT Scan, and this will be listed under Case 4 DICOM zip. Now this case is going to differ slightly from cases 1 through 3 in that the way that we're going to generate the STL model for this case is by cone beam scanning a stone model of the patient. So whereas in the previous 3 cases we've done an optical, desktop scanner scan of their stone model, this one we're actually going to cone beam it. So if the only piece of technology you have in your office is a cone beam, you can still do this entire process. You don't have to have any kind of an optical scanner in your office. So it's a maxillary case. We're going to be placing an implant right up here in the upper left. And so there's no nerve to plot. And the first thing we're going to do is bring in the STL. Now again, it's not in STL format. So rather than saying import STL, I'll go to import DICOMs, and this is going to be a model scan. You'll notice you've also got the option of an impression scan. There's a workflow for scanning PVS impressions as well. Go down to wherever you've saved the cone beam scan of the patient's model, in this case, case 4 model scan. Click OK. And you can limit the field of view if necessary. And here is the 3D rendering. Now this is not yet an STL, this is just a 3D rendering of the cast. Now make a mental note that this density slider is set at 1704. The reason that's important is because generally whenever Blue Sky Plan defaults to a density, it's doing the best rendering it can come up with. However, there are going to be very isolated circumstances where some people might notice that their guides are coming back a little too tight or a little too loose. And I want to show you how to troubleshoot that while we're on this screen. So if I zoom in really closely here, let's take the density slider down to the left. And as you see, what happens is those teeth are getting physically bigger until they start to just distort out. If we go back now to 1700, let's take it to the right. And if you go to the right, the teeth look like they're getting physically smaller. So to think about this, if you were getting to the point of your guide and you try it on the model and things are fitting too tight, then chances are you had the slider too far to this direction because your guide was made on a model that was too small, thus it's not fitting on the true to life model. Vice versa, if you were getting models or guides that are fitting too sloppy, you're probably too far to the left of the spectrum. So when you first do this method, I would suggest just go with whatever Blue Sky Plan suggests doing, assuming that it looks like a decent model on your screen, and just proceed as normal. Chances are you'll never have to even think about this. But if you were to come back once you get the guide and it's just not fitting properly, this would be where you need to tweak that. And you would just maybe need to take it 100 units in either direction until you find that sweet spot where the fit is correct. So I'm going to go back to what Blue Sky suggested and click Next. Now the software is creating the STL model from that 3D rendering. Okay, and here's the result. We now have an STL model of the patient's stone cast, and the next screen it defaults to is to do the auto stitching. So I can stitch this just like we've done in other cases. Push the shift key, left click to drop a point. And I'm just going to do every other tooth. And then click Next. And as you can see, the software has stitched it roughly in the right position. It's difficult to tell from the screen how good it is, so I'm just going to click next and move on back to the home screen. And so here we have that. And so let's analyze the stitch. I'm going to maximize this window, and I can tell right off I don't like the stitch. As you can see right here, it's not fully adapted, and so this is going to have to be restitched. So go to model manipulation. Actually, first of all, you always want to isolate the jaw that you're working on because you don't want to have these mandibular teeth in the way. So very simple to do. Go to your surfaces panel, click the CT, isolate, and then click on the maxilla. And now we have a nicely isolated jaw. Now back to model manipulation panel, and we will be stitching this model. It's a maxilla. We wanted to use points and click align. And now is when it will bring up both screens, and you have to pick the very specific points from one model to the other. And here we go. Maximize the screen and then enlarge it. And as I've shown in the other videos, you want to zoom in, get both models oriented in the same manner so that your mind doesn't play any tricks on you in where you're positioning these dots. And now just begin placing them. Push shift and then place corresponding points from one to the other. And again, I'm looking for distinctive landmarks, things like those little dished out areas in the cusp tips, grooves, wear facets, all of those work really well. I almost messed up and forgot a point right there. Make sure you've got the same number of points on both models. And then click OK. And as you can see right there, the model moved into place, and now this is a much, much better stitch. So I'm in the same slice I was earlier, and now you can see the much tighter adaptation. Okay, so always, always, always check your model adaptation before just trusting this, because your guided surgery will never, ever be any more accurate than your stitch is. Now that we've done that, I can go to Surfaces panel, turn off the CT rendering. I don't really need that. And we can now plan the case. And so you should go through the exercise in a case like this of discerning whether or not you can put two small implants and two smaller teeth, or if you're going to have to do one oversized tooth. So I've done this planning already. There's no way actually in the bone available that two implants can fit. And so unless you were to orthodontically move this tooth, that's not going to be an option. So what was opted for in this case was to crown both teeth since they were pretty beat up, reshape this, and then be able to put one implant in the center that's going to be appropriately sized when the other crowns are done. So I'm going to place a molar, go to your plus tooth, choose the tooth that you're using, and then click in any of the views that you would like. And now you can do your rotations. So if you click on the red of the tooth, it will bodily move it. Look at it from every different dimension. Obviously going to have to stretch this one out a little bit, but I don't want to do the full space because remember we are going to reshape these crowns a bit. Okay, so that is going to be close enough for our purposes here. Once you like it, right click the tooth, lock it, so that way you won't knock it out of position accidentally. And now let's place the implant. So plus implant, I'm going to choose a Blue Sky Bio Biomax 4.3 by 11.5 in the maxilla. And again, I always go to abutment. I choose a custom abutment, 20 millimeters long. And that just gives me a visual reference of where a screw access hole would be. So rough positioning is done in the pan window, and then I usually will switch to the tangential window, which you see here. Okay, so look at it from all your different dimensions. This is looking at it from like at the mesial, and we can pull that in, get this all within bone, spin on around, and you can see we're utilizing every bit of this bone up next to the sinus. We've got pretty good parallelism with the adjacent roots, and that looks pretty good. So very quick if you do it that way. Slightly buckle with the emergence, and we could potentially try to reorient that slightly, but I don't want to go overboard. That's more than restorable, so I'm going to keep it right there. Once you've done that, you're ready to create the guide. You no longer need the tooth on, so the tooth can be turned off by hitting this tooth button. And you need to turn on your guide tube before proceeding to the surgical guide. So go to Panels, go to your implant list, and make sure you check on this box right here that has the guide tube. Sorry, phone call there. And so right now it's set on the direct cut drills. I'm going to use the Blue Sky Bio fully guided surgical kit. And so that looks great. And now we're ready to create the guide. Let's lock this position. And now Panels, Guide Fabrication. We're going to do it on Model Scan as the model. Use the automatic brush. Sorry about the phone. Lock the implants in virtual teeth. And then I always choose high quality. And then Maxilla. And draw curve. Now I always want to maximize this window so that I can see more clearly, and push your shift button and then left click and begin drawing your line. We'll go over to the opposite canine, reorient, let go of your shift key obviously, continue on. Until you get back to where you started. And once you've done that, you can edit the curve. If it needs to be fine-tuned any, like grabbing those nodes, you can do that. If you like it, you're ready to create the surgical guide. So now you see the surgical guide has been completed. You're always able to add the text if you would like, and position the model behind it. And then just apply text. And then finally, to export the surgical guide, you would go to File, Export Data, and then turn off everything that you don't want to export, like the guide tube, the abutment, the implant, the model scan. All we want to export is the surgical guide. Export it to wherever on your computer you would like. And that completes the case. The only other thing you may want to do is the drill report. Go to File, Drill Report. And you can print a PDF of this. And there's a lot of different options of how you structure that PDF, you know, 1 image per page or whatever. But that's the end of this case. And so that takes care of all of the basic cases for this training.